Today, Dr. Dahl is here to talk about thyroid disease and specifically my blood work, which showed up with some thyroid issues. Welcome back, Dr. Dahl.
Hello.
So, yeah, you're going to tell me how bad it is.
And actually, before we started, we were realizing that thyroid disease is pretty common because it seems like more than one of us here.
Yeah,
seems to
have it.
I
started doing this because I'm hot.
Does it get worse as you get older, your thyroid
it's just
condition?
more likely that you could develop thyroid disease. But the thing is, if you treat it, you should really, feel pretty good.
But it goes undiagnosed a lot, right?
That's the problem. So symptoms of thyroid disease: fatigue, constipation, weight gain, dry skin, sometimes hair loss. Some women, if they're having really heavy periods, that'll be a symptom. So kind of like non-specific stuff. And when you go to your doctor and you're like, I'm fatigued. Depression actually is another thing.
And I had hyperthyroidism initially, so I had tremors in my hands.
Right.
My feet were swelling. I was having heart palpitations. It was terrible.
Wow. Right. Okay, so what did you learn about me? How
so
bad is it?
For you,
Am I gonna live?
it wasn't that bad actually when we talked about this when you first did your test. But you were definitely in the hypothyroid, range of things.
Okay,
so that means any of those symptoms.
Hyper.
So hypo means you're sort of the sluggish, underactive thyroid.
Which means you kind of gain weight.
Yeah.
Because your thyroid controls your metabolism and so many other things.
Controls all
Don't
of
you
that.
love that you have something to blame it on now?
Blame it
on.
Because you know what? I've been working out and I eat, well, except for that apple crumble.
Well,
but
we
anyway.
saw that apple crumble.
And the martini and beer and whatever.
Oh, yeah, okay.
Don't say that too
And the
loud.
Mexican food I had all weekend. Besides that, everything's just, I should be just dropping pounds left and right.
Right. So, I mean, it takes time. It's not like you take the pill and it's not a weight loss pill,
Okay.
but it does help regulate our metabolism. The thing is, if you have autoimmune thyroid disease, which is something that I want to talk about, because if you have that, your regular thyroid test doesn't always come back abnormal. And you have all these symptoms. You're like, I know something's wrong with me. And you go to your doctor and they do this thyroid test and it's like, you're perfect, you're fine. I'm like, but I have everything. So when I talk to patients, I'm like, I want to know what you feel. I want to know all your symptoms, not just look at a number and make a decision based on that number. So then we'll do some more advanced testing and look at other parameters, additional thyroid tests that we can do, and then antibody testing, because thyroid antibody testing can actually detect whether you have this autoimmune condition that may take years before it actually shows up in the regular test. And that can really then delay diagnosis. I mean, even myself, I was in medical school when I diagnosed my own thyroid, and I'm an energetic person, and I was like drinking a whole pot of coffee to simply stay awake for a few hours in clinic. And people would say, oh, you're depressed, honey, you're in medical school, here's
stress.
an antidepressant, you're gonna be okay. And the antidepressant doesn't fix your thyroid problem.
Right.
So,
Is this something that men have to deal with as well?
Yes. We probably see it a little bit more commonly in women, but absolutely men can have thyroid disease too. So it's so important that we diagnose, and it's so common. Women who have thyroid disease and become pregnant can have problems in pregnancy if their thyroid's not treated and addressed.
And even problems conceiving initially,
yes,
right?
it can sometimes cause some issues with fertility and stuff.
Have you stayed on your thyroid medicine all this
I've been
time?
on Synthroid for bazillion years, for 15, 20 years.
Okay, well, so I'm going to be honest. I was on it, and then I ran out, and I didn't get the prescription renewed, so I've been off. That's why I've been gaining weight.
The problem. So the thing with thyroid is you really don't want to stop the medication because you're definitely going to slowly move back into that zone.
So did I make it worse?
Amy,
Actually?
didn't the thyroid do something weird to you? The medication, was it the thyroid
No,
medication?
that was the testosterone.
Okay.
Yeah. No way no for me.
No, the hormone stuff, I get a little nervous about that.
Yeah.
Does thyroid go hand in hand with some hormone abnormalities?
Well, I mean, our body is so connected. So obviously when your thyroid, your metabolism is off, the fact that hormones could also be, off and other things. But it's something that you definitely don't want to stop thyroid treatment if you've been diagnosed with a true autoimmune thyroid issue. Some people just have a transient thyroid problem because they had an illness or a virus or something that triggered something to go up with their thyroid gland, but it actually goes away. But other times, it lasts. And in most people, if they have autoimmune disease, it'll be lifelong. And you really need to treat it.
Is there a natural way to treat it besides
Everybody always wants to
Synthroid?
do natural when it comes to, well, you can do things other than Synthroid. I mean, there's different types of thyroid that's natural. And honestly, for me, I mean, Synthroid has always worked really well for me. It's easy to dose. Thyroid problems are really tough to get people on the right dose.
Yeah.
I mean, just a tiny little 0.1, 0.75 versus 0.88 can make a big difference.
I think that's why I didn't get it renewed, because I didn't think it was making a difference.
Yeah, and you have to titrate it up. You have to start low and then gradually increase it. Otherwise, if your thyroid's been sluggish for years and then all of a sudden you take this hormone that's like, puts you in the other range, you could feel pretty sick from that. So you have to go really, really slow.
Gradual.